Okay, that's perfect timing. Thank you so much, Copenhagen ambulance. You see, we have really coordinated our efforts to give you this live show, and thank you for dialing in wherever across Europe we are doing it today. We have also a group of people sitting here with us in Copenhagen. I see very many faces, and very excited to have this first, I think, hybrid event in the EIT Health Alumni Series. We have had lots of physical events before this. We have had lots of webinars. I think many of you have dialed in, but this time we try something new. We have half a group here physically. Also half of the speakers here with me today, Rebecca, and then the other half, another speaker, Vincent, and another group dialing in. So very excited to have you here in Sandhub, Copenhagen, and in partnership with University of Copenhagen and also Tech Barbecue. Sorry, there's so many tech events. But let's get it started. So I'm very honored. I hope that you have I see many people having the coffee mugs at hand. And if you're also dialing in today anywhere from Europe, that you have your tea or coffee or hot chocolate mug to join us for this session with Rebecca, who is the Chief Operating Officer of TADA Medical based on Sweden. And we have Vincent dialing in from Ireland, the CEO of Gasgon Medical. Welcome. And in order to, how the format today looks like, so in the beginning, Rebecca and Vincent share a bit of the story, how two EIT accelerated startups met and joined the forces and did something great already earlier this year. And later we can take questions and answers from this audience here, as well as anywhere you are dialing in today. If you do have questions during the presentation, you can put them in the chat box of the Zoom. So I would see the questions that are coming in. And if you have questions here in the room, you can signal with a hand. So I would know. So it's a double system, but let's try to work it out. But floor is yours, Vincent and Rebecca. I don't know who starts first. Welcome.
Sorry, Timo, you need to just enable me to share screen, please.
Yes. Vincent, do you have sharing rights? No.
No, not yet.
Okay, now.
Okay.
The second screen. Perfect.
Okay. Okay, very good. So firstly, thank you, Timo, and thank you, EIT Health Alumni Network, for the opportunity to present here today. I'm deeply, deeply sorry I couldn't be in Copenhagen with you. Work has kept me here in Cork, but I'm glad Rebecca is there to co-present, and hopefully we'll share some of the story we have relating to our project Swirl, which is a combination of Sweden and Ireland working together in partnership on a project which we call SAFE-Infusion, which is all around stopping adverse fluid events in infusion of IV drugs. So Rebecca, I'm going to let you introduce TADA Medical's background story. I'll introduce Gasgon's, and then we'll talk around the project, how it came together, and the success we've had with it recently.
Thank you, Vincent. So the TADA team, we founded a company in 2016, and that was right after we graduated from the Clinical Innovation Fellowships, which is a program now held by EIT Health. So the entire program is brilliant. You know, we have this, you apply as to any other job, but you apply within your own discipline. So you want a team with 4 complementary people, 1 in technology, 1 in design, 1 in management, and 1 in medicine. And you are given a clinic. So here, spend time here, find all the needs they have and try to solve as many as possible, more or less. And it's also an education for us as entrepreneurs. We had to write a business plan for our favorite need. And I will talk about that later. So that's where we started with this relationship with the EIT Health. Then in 2017, we got the Head Start funding. Also, again, thank you, EIT Health. I think most of my posts on LinkedIn for several years was, thank you, EIT Health. Sorry. Anyway, so, and the Catapult, that is the most amazing thing ever. Like, do that. The EIT Health Catapult. We have friends for life from that. It's such an amazing place where you meet people that you're supposed to compete with. And you end up being friends instead, and you help each other, even though you know you're up on stage just, you know, a few minutes later, and you kind of want to tell them that, you know, do this and that just to bring them down. It is totally impossible because everybody just loves what they do, and that energy spreads. It's brilliant. Do that. The Investors Network that we joined in 2019, and then in 2020, then we started applying for funding, not only as TADA, but also thought that, okay, let's try to bring this together, build a consortium, things like that. We went to matchmakings, and we've got funded in 2020, but we're gonna come back to that later. So Vincent, please, thank you. When we started, we were 4 of us. We lost 1 founder, but 3 of us are still going strong. So Katarina, CEO, me and Christopher, we are the founders of the company. And then we kind of grown. And, you know, the funny thing is that this slide, I think I sent it to Vincent on like, I don't know, maybe Monday. And that was the team on Monday. It doesn't even look on like that now. You know, we have new people in yesterday and today. We have this brilliant program in Sweden, Jobbsprånget, where you can come in as an, you know, you came to Sweden with a partner, and it's hard to get a job if you don't speak Swedish, if you have a weird name, like Swedish people can just judge you because of that. And we're a global company, or we have a global market, so we don't care. Like, if you are a brilliant person, we would like to hire you. So this is my multidisciplinary, multicultural, brilliant team. Most of them, apart from, you know, Monday and Tuesday and Wednesday people. Sorry about that, people dialing in. I should have updated the slide. Next, please. So the favorite need, the one that we're solving, it's accidental dislodgement. You know, when you get into, like, I think 90% of all in-hospital patients, they get IV therapy. And every 10th tube are getting pulled during use by the patient themselves, delirium, Alzheimer's, whatever, you know, drunk people, an accident, a nurse, or you get caught in something. And see, I'm practicing holding this, sorry. I'm doing good. And we thought, okay, someone surely has solved this already. That was a part of the program. So, like, don't invent the wheel again. And we scouted, you know, the market, and it's all about securement devices. So keep the tube, the catheter, you know, tape it harder to the patient. You have these skin anchors, all of these things, but, you know, create a stronger bond. And that is not really a solution that works because people pull really, really hard. So we did the opposite. So this is a weak link instead. So you put our connector, RELINK, between the patient and the IV line, and now you can pull the line and it pops out. So what happens is that the catheter stays in the person. We have a double valve system. It closes on both ends. We can't lose any blood, any drug, anything like that. And you can clean it and reconnect it. And it's like nothing happened. So instead of wasting 30 minutes on reinstating therapy, you can come down to 3 minutes. So this is what I'm pitching when I'm out. And we got a CE mark. We got an ISO certificate for the company. So, you know, just trying to sell the company. And yeah, anyway, thank you. Vincent, you're up.
Thanks, Rebecca. I love the fact that you're always trying to sell the company. So Gasgon Medical started similarly. EIT Health is a huge part of our startup journey. The concept came out of a university project in 2016 where doctors had highlighted issues with air bubbles in their IV fluids. And so I created a technology to remove the bubble from the IV without disrupting the flow of the fluid. And for, I suppose, the first 2 years, I was looking for product market fit and trying to understand how you take a concept and build it and get it into hospitals when you have zero funding. And so it was all about that first business plan. EIT Health came along in 2018 and gave us a Head Start grant of €50,000, which, a bit like Rebecca, kept me alive for that first important year. I immediately incorporated the company and built a business plan around going to market. We were lucky enough, I was lucky to receive a SME phase 1 grant, and that was another 50K. And again, that was another little bit to keep the dream alive, so to speak. And those were kind of the hard yards of early stage of entrepreneurship in medical devices, needing to have prototypes of devices and needing to have team support and not having the money and funding to do it. Things were ramping up all the time, and we were on stage at European Health Catapult in December of 2019 in Paris, where Gasgon was awarded second place overall in medtech for Europe, which was a fantastic achievement that I'm very proud of. But it was also a very important event for the people that we met at that time. And the meetings there led on to eventually the investment that we received, a €3 million grant for our joint project from the European Innovation Council. Like Rebecca, we're a growing team. I started as one, we're now at 5 and growing rapidly as the investment comes through and we build up our project. We're wrapping talent around it. So this part is going well, and we're delighted to have that extra support and those skills coming in all the right areas. The project that we are working on, the product is called AirVault. It's a single-use closed system aspirator that connects to IV lines, and it essentially removes the bubble from the IV without impacting the flow rate of the drug. So it stops nurses from having to respond and manually intervene to air bubbles when they see them. Those bubbles are dangerous and harmful to patients, and they have to be removed. And so our device is intended to improve efficiency of workflows for nurses, but also safety for patients and for the nurses themselves. And that is the product that we were bringing to market. And we were lucky enough, as I say, to be supported by EIT Health at all stages of our early startup. We consider ourselves, I think, TADA and Gasgon as EIT Health babies in a way. We've used all of the supports for each stage of the early innovation and acceleration. I think the one we want to talk about today is matchmaking, most importantly, and what it meant to us in developing the Swirl project. So this was kind of a quick timeline. Our first meeting, TADA and Gasgon, happened because of a mutual contact who had met me at Head Start and had met TADA at Catapult. He said, hey, you guys should talk. And so Rebecca reached out to me on LinkedIn, and that was our first contact right at the end of 2018 in December.
May I say that, Vincent, that he actually thought that we were competitors. So we were warned about these guys. Like, maybe you should not get in. He didn't say that get in touch with you. He said you should look them up, honestly. Well, we did, and it appears it was a match.
Yeah, and I think that was the first important thing, Rebecca. Once we realized we weren't competitors, we then started to go, well, what can you do for me then? What can I do for you? And I think that was really the start of our relationship of working together. It wasn't until later in 2019, in September, Rebecca came to Galway in Ireland to a medtech conference. And that first in-person meeting was where we really started to judge each other, I guess, and work out, you know, what is your motivation? What drives you? Is it the same thing? We knew we had a similar market entry point. We weren't crossing over or competing in any way. So it became very kind of almost a fun project of, well, what can we do to help each other to get past those hurdles that are there for both of us? That first meeting in September 2019, we had a second meeting at the Catapult finals in Paris. And this is where matchmaking really kicked in. So at that event, we met Alexander, who's the leader at Coimbra University Hospital. And he was one of several people that we met, but immediately he responded to the two devices that we were proposing because they worked so well together for infusion. And he wanted to make life better for his staff in the hospitals. And so that was our first partner, I guess, in a project that we still hadn't yet defined what could this be. The follow-up was matchmaking 2 in Berlin in February, not much later, where we found a second hospital partner. And we started to put the pieces together saying, you know, we've got an Ireland and a Sweden company. We now have a Portugal and a Spain hospital. So this is an international consortium. We're all working together to solve a problem. And we began to build out the Swirl project. So between February and June, I think myself and Rebecca and the teams, or both of our teams, just got together as much as we could and started to write a proposal for fast-track innovation. We put significant effort in. I think that has to be really kind of noticed in all of this. There was a lot of late nights. This was extra to all the work we were doing on our products. But we persevered because we felt we could really support. We had great hospitals, we had a great consortium. We just needed money to make it happen. And so we went looking for grants. Bad news, on our first fast-track innovation proposal, we got a rejection. Which is always hard because you've worked very hard, late nights and all that comes with it. And we had to look at the situation and go, right, with these partners, are they winning partners? Where did we fall down? You know, what are the bad points of the project we've created? And is it worth us going back together for something else? Ultimately, our score was quite positive and it indicated that we were close. We were very close. And so we decided we'd put more effort back in. Rebecca, I think you can talk about the effort between June and October in stripping out the proposal, taking away all of the heavy language I think that we were using around it, supporting each other in making a cleaner, better proposal, and still putting in crazy hours to make that happen.
It was a lot about refining at that point, I think. Like what, especially for this, like all of you who have ever written something for the second time, you know that you're gonna use what you wrote the first time. And this is, of course, what you do if you have a joint application like this, like what can we find? And as Vincent said, he has the SME phase 1 that they won. Perfect. Then we know that's a winning proposal. We had applied then for the phase 2 grant, the SME instrument that changed the name to something, Accelerator. Yes, that one. We had applied several times for that one. And we were pretty happy, even though, you know, EIC weren't as happy. We got it later, so, you know, it's fine. So, but merging 2 applications, and then you're going to have double of things, like double on the market, double on this and that. And some is going to be well written and some is maybe not. And that showed, I think, in the first one we submitted, that it was kind of a patchwork. And things came in late. We didn't necessarily know how much can we rely on a hospital in the middle of a pandemic to give us data. How much can we push them? We can't go and see people. So I think that summer and into the autumn, it was much about that. Like everybody's still in. All the brilliant partners are here. How can we refine the text? How can we remove all this? Because it's still like you're only allowed a certain number of pages. It's like 30 pages, which is short, which sounds ridiculous, but it is. When you have so many things to say, that you have 5 partners to describe, you have 3 products to describe and how they work together and everything.
And all the meetings you had, they were like virtual, right?
Yeah.
You never kind of like, apart from the few meetings in person, most of the work was basically through Zoom.
Everything had to be. That last thing in the matchmaking in Berlin. Yeah, then the world closed kind of after that. So
that's probably also inspiration for you that you are dialing in today, or like over here in the audience, that if people can pull off this through Zoom calls, then, I mean, now it seems like the world is returning to normality, at least here in Copenhagen. It looks like 2019 pretty much, that consider what you could do. And if you don't have the partners yet, like I think EIT Health has so many partners that maybe even in this room or this call today, you could partner with.
Yeah, and it's like, it really helps to have met people. If we're going to sit up a night and debate something through a SharePoint document and not, you know, fight about it that you don't want to speak the next day, then it's good to have met before. because there's only so much relationship you can build online, I think.
Yeah, it certainly helped to have started that interpersonal, but as the project grew on, there was a lot of people that came in after March when things had shut down that we hadn't met, you know, like I'd met Rebecca face-to-face in Katarina, but the rest of the TADA team I hadn't met, and they put in, you know, fantastic effort, the same as the Gasgon team, and these people were working late into the night with people they'd never met, and I think that, you know, hopefully we're coming back out of some of that now, but it shows it can be done. The next stage in our journey is that we were awarded 3 million euros. So, you know, for us, quite incredible, pretty much within 12 months of meeting and starting the idea of a project to have 3 million euros funding in to what was essentially a complex story of 3 different startups creating different products. I forgot to mention remote signals actually back on our journey, the part where we brought in an additional, apologies to remote, we brought in an additional partner to really pad out areas where we felt that there was technology gaps that the hospitals were kind of pushing for. So overall, we were awarded 3 million euros. The next piece of the process, you know, it's all part of it, and we need to understand this is when it gets real. There was an over and a back among all the partners to sign legal agreements, consortium agreements. It's complex when it's multi-country and multi-partners, but again, because we built very good foundations, we got through that. You know, we're all still talking and everyone is happy. And the project kicked off on the 1st of April this year officially. And next month we will have our first hospital visits in Portugal and Spain as well. And that is basically our journey from initially first meeting to pretty much a year of work to getting a 3 million euro funded project. I think, you know, these are the 5 partners that we have, 3 products. Ultimately, we are all working together because we're focused on this one big health impact of making IV infusions safer, cheaper, and better for patients and for clinicians to deliver. Just to highlight how tricky it can be, because people will have gone for grants, as we did multiple times and didn't receive them. There were 14 fast-tracked innovation projects awarded out of 717, so just under 2% of projects got funded. So we don't take it lightly. There's a lot of work involved in bringing together different partners in different countries, but it is definitely possible. We're proof that you can do it. Just, I suppose, quick learnings that myself and Rebecca wanted to talk about, the bits that we have found as we work together that might be interesting and things to look out for as anyone is trying to put together a consortium. The first one we always come back to is energy, and Rebecca mentioned earlier. You have to have people who are going to pull you forward in your partnerships. The same as any team, you know, you're building an international team. Bad energy people, you need to kind of figure them out pretty quickly and not go in that direction. It's hard work getting these projects off the ground. It's hard work then building the projects, right? The funding just gets it started. So definitely look for good energy people, and definitely if you find someone who's not good energy, consider going a different direction. You'll need all that good energy later. Rebecca, trust, I think was the key thing from the outset. Once we got over that initial thing of, oh, are we competing, are we not? It came down to how much can I share with you? How much can I trust you? And how much, you know, can you trust me? And we give it back and reciprocate. That was the foundation of us basically building a successful brand and successful companies going forward, we hope. Alignment on goals, Rebecca.
So now it's my turn. Yes. I want to speak about the energy. That's more fun. Okay, so fine. No, but I should get back to that, because it's not as easy as it sounds. The instinct and all the energy and all of that, honestly, because sometimes you meet really, really good people on paper. Really good people. Like, I want to have this guy in because I want to show that I work with him, or I want to work with this organization. And then you meet the person and they're like, not very nice. And then you need to be brave enough to say that, no, this is never going to work, because I can't do a project. If I get granted the money, I'm stuck with this person for 2 or 3 years or whatever it is. So you need to trust your instinct, and you need to be brave enough to act on it. That's brave should probably be in there also. So no, alignment of goals. like it comes down to also the communication. They belong together. So if we're going to do this, and like the 3, 4, and 5 all belong together, I think. We have a common goal, but in reaching that, all of the partners need to know that they achieve something that is good for them and possibly good only for them. Because at the end of the day, that's kind of who you care about, is mostly you. So I know that you reached the common goal by doing good for you. I think it needs to go in there somehow. And it's also, we got told that we look good on paper together. And I think that is a part of it, that everybody brings something to the table, something else.
Yeah, that probably leads into number 7 then as well, which is the balance of natural skills. And I think that was one of the key things we learned once we got to grips with each other, was there are things that TADA does really well that Gasgon was missing, and vice versa. And it was just sharing those resources as much as we could, that alignment on goals and the trust and everything just started to feed itself at that point. Because we knew working together was going to make us stronger and deliver ultimately better products into the marketplace with more impact possible. Number 5, just to be clear on it, is what is in it for me? What's in it for me? You have to have a little bit of that, because at the end of it all, Gasgon is a company in its own right. So is TADA, so is Remote Signals, and hospitals. Everyone had their own piece of, what am I getting from this? And is it enough to go through the hard yards when the project was, not going well or complications came up? So you have to really set that goal and set that ambition and be prepared to do the work then in partnership to make it deliver. And that's probably the last one there, which is hard work. We've mentioned it a few times now. It didn't fall from the sky for us, I guess. We had to get over many challenges in our approach. We had to knit together 2 totally opposing cultures, I suppose, in terms of what our companies are, and make that work. And we did I would say, a good job on that. And ultimately we got the grants awarded because, external evaluators were able to see that we were pulling together for a common good. I'm going to finish speaking there now and open the floor to questions. But the last point I wanted to make, really talking on matchmaking and EIT health, it occurred to me not too long ago that we're here because of the matchmaking platform. What EIT does really well is that networking effect of putting the smartest people together in rooms. And when you have smart people who are driven to solve problems in rooms talking, inevitably something good is going to come out of that. And we kind of leveraged that opportunity. And I would just say to anyone who's here listening, take those opportunities. I know I'm not on the plane in Copenhagen today. I wish I was. So I'm kind of talking against my own advice here, but my advice is get on the plane, go take the meeting, have the conversations, and just make it work for yourself and make it happen. So I'll leave it there. Rebecca, if you have any closing comments.
No comment.
Well, great. Thank you so much, Vincent and Rebecca. And I hope you got some inspiration from this journey. Even more, I hope that you have some questions, maybe related to your own journey or some ideas. I mean, now you have wonderful opportunity to ask these questions from the 2 powerful C-suite and very successful examples that maybe could help your journey. Do we have any person having question either online, dialing in today, or in this room? Feel free to let us know. So we have 2 questions. Yes, Vincent, could you stop sharing the screen so we could see more people on this? Perfect. Thank you so much. So we have first question. Okay. Yeah.
Cool. So listening to the story of 2 companies coming together, I'm also thinking about the phases of how the relationship evolved. And at some point you have to enter a stage of co-creation. And I was just wondering if you have any insights or tips on how to make it into an efficient, creative, productive sort of phase, and how you overcame any tensions.
I'm going to let Rebecca answer all the difficult questions.
regarding tensions, we are fighting, Vincent and I, but we like each other, so we make up again. The co-creation, I'm not sure if we've gotten that far. Like, we came into this with more or less ready concept, all three of us, sort of. But we are, to be honest, we are writing an agreement between the industry partners now, that what happens when we go to the hospitals, when we start seeing things, when we sit down properly. It's so much harder to do this, I think, online. We haven't had any of those kind of meetings. Like, once we got funded, before that, it was all about writing. And then when we got funded, it's like, oh shit, now we have money. Now we need to start deliver on this. We need to start build the devices. All of these things. And that has been like since April, what is that, like 5-6 months? So a lot of energy has been put into that. Now we are having weekly meetings, but it's honestly more about reporting what did you guys do. So we're not there yet, but we expect to be, once the project gets a bit further, when we start with clinical trials, when we go back to seeing all the weird things that happen, and what else could we do? What other problems can we solve? So I don't know, like from the clinical perspective, we come from a background, or my company come from the background of that, of brainstorming, of not necessarily co-creating, but at least, bringing all the brilliant people into one room. But we haven't tried it between the companies yet. Vincent, do you want to add something about that?
No, just that, the structure of the Fast Track Innovation grant that we received was about supporting each of our individual projects and products. So it funded our manufacturing and trials of our devices. There are areas where we overlap within the clinical trials, and we had to kind of pick our way carefully through that scenario. Ultimately, you have to find a way to maintain your kind of company autonomy where possible. And of course, there's going to be overlap then in ideas. Whose idea was that, and how do we kind of split this up? And so we have a consortium agreement among the commercial partners and the academic partners as to who owns foreground and background IP as it's being developed. So again, just being cautious for everyone as you're developing that IP, have those structures in place up front so there's no arguments later.
Awesome. And I see that we have also a question I saw from the audience, but this time we also have a question from people dialing in. And thank you so much, Petra. Petra is asking, how much did you have to rely on the financial support outside the EIT Health? Did you also have some other grants or investors to survive without the next like EIT Health, or like, let's say, European grant, like revenue, cash, investors, angels, VCs? Yep.
Well, I can go first. So revenue is kind of tricky when you do a medical device because it takes a long time. You can't release a beta version to your potential customers and see if they love it or hate it. So we got really good at finding smaller monies. That's not smaller grants, smaller Swedish grants. So you have Vinnova, the Swedish innovation agency. What can you get from them? And then you get maybe 10K, you get 20K as in euro. So we survived a lot on that. And in 2019, we brought in angel investors. So in 2 tranches, both in 19. Maybe not that much. It was like 500,000 euro in total. But then when we got the accelerator grant, that was like a huge thing. And that is in 2020. So we will never have survived on EIT Health funding alone. That is not possible.
I would echo that as well. Certainly EIT was kind of the first money in, it was uncomplicated money, should we say, the Head Start, 50,000 euros, non-equity, and it really was about supporting us at an earlier stage, and you just have to tease that along. Gasgon survived on kind of fumes at different stages. You have to get realistic about your spending and what you can achieve. It's pillar to post. It was all kind of competitions and small grants and vouchers for things. Really, the first significant funding for a Gasgon perspective was this EIC Fast Track grant. That has enabled me to bring in team members and to move into manufacturing operations phase within the business. So it was very much a survival mode up to this point. EIT were part of helping us survive. And every outside of money, the confidence that it gave from EIT supporting, not just to me, but to investors who were looking in at that time saying, well, you know, this is happening in Europe, something is going on. And, you know, those investors are now part of the investment round that we're closing out at the moment. They were part of watching our journey. So not just funding, but building all of those supports and networks. They're there then when you need to lean into them later. So
I'm actually like in this regards, you said, Vincent, that at one point you were on the fumes, and I think this COVID-19 probably had like different impacts across different industries. I know that some sectors, they had to fire probably a lot of people. When you're on the fumes, did you, like, I think Rebecca, you mentioned that at one point you really had to decide people and say no, like, I don't want to include that project in the beginning. Like, did you also have any part of your journey where you actually had to fire people because that the cash flows were?
No, we had, when we brought in the angel investors in 19, up until that point, it was only Katarina and I working and having some sort of salary. So then it was easier because then we just said that, okay, we're not getting a salary this month. So when we got the angel investors, like before that is still an internal joke between me and Katarina as a CEO, that because I wasn't allowed to buy even a trash bag. We were down to like zero, no money. And we had huge patent costs coming up, like 50,000 euro cost coming up. We had zero money. So like, if we don't close the round, then we're going to lose the patent because, you know, it expires. You have like until 30 or 31 months and then that's it. So that was a scary time. But then we brought in employees. And after that, you have to think differently because you can't not pay salary. That's probably against the law, I think. I'm pretty sure that's one of those things that you shouldn't do unless you kind of funded the company and said that, okay, not this month.
A very special negotiation. I saw that there are a few more questions here, and Byram.
Yes, what a journey. It's very inspirational to see what you've achieved. I was just wondering, how do you split equity in this type of collaborations? Like, what kind of progress did you go through when you start talking about do this type of collaboration? I don't. Now, just thinking about like, I guess that you had some kind of equity in your company, right? And Vincent had it in his own. And then you start collaborating. How did you manage to figure it out together? Like, did you split it out equally, or did you somehow negotiate, or what kind of progress do you go through at that point?
Okay.
How they split the 3 million euros, basically.
Okay. So the key thing about, from my mind anyway, at least, the key thing about getting funding from a European, EIC or EIT Health or any of these major funding bodies is you have to have a very realistic project that actually has a commercial potential as well as an important impact. They're difficult to get. And so, I think the basis of it is that we have very good companies in their own right, and the technologies we're developing stand up on their own. Us working together was about fast tracking and sharing resources and delivering it cheaper ultimately for everybody. We put together the proposal, which was a very realistic business plan about us developing our technologies, what it was going to take to get the evidence, what we needed to do, and the financial planning around each of those steps over a 2-year project. And in its own right, it's a clear business plan. In terms of the equity piece of it, we don't take equity from it. It's a non-dilutive grant, firstly, which is important. And so we just remain as 3 individual commercial partners within the structures of it. It's ultimately funding each of our products to be developed.
But we can say that we had discussions about the budget, because the budget doesn't necessarily reflect what we would need to spend to do a certain task. It was a balance about it will look better if also, like, how do you split 3 million on 5 partners? And how much money should you get the first year or the second year? And should the industry partners have more? Should the hospitals have less? If we have 4 wards in this hospital, should they have more than the hospital that has 1 ward? What will look good? Like the Spanish salary and the Portuguese salary, should we even care about things? Do people know that? Who is going to read it? Do they believe the budget? So it's all about selling a budget. We have a lot of things in there that we will have to pay for ourselves, because it's not that the budget is necessarily a lie, but to fit it into 3 million, we had to, not remove things because we need to do them, but we have to say that, okay, they're cheaper than they actually are. We can say that also that this is, you get 70% of the funding as an industry partner. 30% you have to find yourself somehow. And a hospital or an academic partner, they get 100% funding for whatever they put in. So it took a while to create the budget. Yep.
Well, awesome. I think, yeah, the money is always heated discussion, especially like the ones attending maybe also this today and tomorrow at the Tech Park barbecue. You probably have seen, maybe even some of you had also talks with investors and anticipate things. But great. Hello. If anyone dialing in today, again, if you do have questions, feel free to put it in the chat. And if you have questions here in this room, I see 1, 2, 3 hands already. I think Christoph was the fastest, and then Larissa, and then Benedict.
Hi, okay, I have 2 questions. The first one is simple. So practicalities. So is it 1 tube with 2 little thingies on it? Oh, just the thingy, just the little, okay. So you don't distribute the tube with those things, like you just, okay, and the hospital needs to insert your little thingies in the tube? Cool, awesome. So that was the first one. Then the second one, my company has been approached by many project writers from Spain, also Portugal, different countries. As I understood from you guys, you didn't use any project writers. You wrote everything yourself. Is that you used? Okay, so could you please share that experience? Because we're almost there. We need to sign a contract, but we're not there yet. And I would like to hear about that experience.
Yeah, we did. We kind of assessed where we were in terms of the position of Gasgon with the business plan we had, and TADA with the business plan they had. Putting it together, it was a mishmash, and we felt we needed some external support of a writer who understood the European grant framework and the types of languages to use. And it was clear once we kind of engaged that support, that it was a worthwhile endeavor. The shape of the proposal changed, the business plan changed, the structures of the financials, it all became more clear to us. And I think overall, we could say we were very happy with having used that service to deliver essentially a project proposal that had a winning look about it. Not taking away from the businesses we had, the products we had, but the way that language was being used after using a consultant, definitely added value. And I think was an important part of us probably being seen in the light that the review committee wanted to see. Is that fair, Rebecca?
Yeah, it's to get their strategic views on it. As we spoke about the budget, they will know what will look good. If you have 2 industry partners and they're the same size, should they have the same budget? Yes and no, these kind of things. Like we relied on them for a lot of the strategic parts. They would know, like in this section, you should go heavy on this one. In like the work packages, okay, you can tone this now down, but these details, they want to see, like they can have us and them. What do they want to see about it? No, you should use them, use people.
It can be done without grant writers, but how hard do you want to make it?
But I think that's like we did the accelerator ourselves. So TADA wrote the accelerator. We had someone helping us prepare for the pitch session of it, but that was it. But then it's a single entity And then everything is slightly easier with the budget and everything. You don't have to consider so much of that. I think now, and we also TADA also has Eurostars approved with, and there's only 2 partners, but it's the same that you have to figure out how do you write when you have several partners, what would look good, honestly. And all these stupid portal things that you have to submit, it's really nice to have someone who knows how to do that. Sorry.
Yeah, which you know, to that lastminute.com situation where it was down to less than 2 minutes, I think, for the proposal we put in. We were under 2 minutes getting it approved, and that was only because our grant writer knew where to put the piece at the very last seconds. That's how close we were to not having a €3 million grant awarded, you know, within that kind of 2 minute time frame. So that's where they earned their salt a little bit. And these frameworks keep changing, the portals keep changing, and you know, none of us are experts since we've gone through it several times. And because some of the newer grants, you know, they've limited you, right? The new accelerator, I think you can only do twice. It could take you 2 goes just to figure out how to use the portal correctly. So, you know, to that end, it's no harm to have external support.
I think the European Commission could learn a bit of like startup user interface. But we have 2 more people I remember asking questions. So Larissa.
Yeah, so I have like 2 questions as well. Firstly, you mentioned that in your first group, there was 4 roles, different roles like technology, management, design, and medicine, the medical side. I was wondering how important you think these 4 roles are, or do you think the rapport and the friendship or camaraderie between the group is more important? Yeah, maybe this question first.
Wait, that's a really good question, but it's hard to answer it with an. Okay, like this. When we did the interviews for the SIF program, it wasn't only about what we have studied or worked with. It was an intelligence test, a stress test, and a personality test. So we are supposed to be a perfect team. We are supposed to be complementary also in if you have a holistic view on things, or if you're an integrated detail person. So it was even a case study that we have to do in front of people watching, you know, and that was actually just me and CEO Katarina. So we had to solve a problem and all the need that, you know, find a solution for this. We're just going to sit here and watch. Just to see how we work together. I don't know if there was something that they thought that maybe we will not be able to work on if both of us wanted to be in charge or something like that. They were evaluating us for, I don't know, at least 2-3 weeks or something. So it's not only about that, but I think the reason that the 3 of us, Christopher and Katarina, are still together is because we like each other. It's as simple as that, speaking about the energy, but it do help. It helps a lot that we come with different backgrounds. And I think that Katarina will agree if she were here that what you learn when you work with someone who has a different background is that you can ask questions that they would know without feeling embarrassed, because it's not something that you should know. And somehow that it's releasing, that's probably not the right word, but it makes it easier to ask stupid questions in any areas, because you started from that is free. We also learn how to brainstorm and not, you know, bring down each other's energies and ideas, and that you're never allowed to say no. You can say, okay, and if we also, you know, all of these things. So no, I think work with someone you like. If you have the same engineering background or whatever it is, like shit happens. Yeah.
Yeah, and I probably, from a Gasgon perspective, just to kind of give a different side of it, I was a solo founder for many of the early years, and all of those hard conversations and opposing points of view I was having to have with myself. So it's, you know, the only person I could fire was myself for a long time if things didn't work out. I was lucky enough to be joined by Dan, you know, in kind of March of last year, and Dan kind of believed, I think, in what the project was aiming towards, and worked for free on the project until we got to a funding point. And so, you know, to Rebecca's point, if you have people who like you and you get on and you can, the first thing is, can we fight, still go to work tomorrow together? That's really important in starting any team up, but somebody who is willing to do those hard yards and put in the energy for very little return in the early stages, in the belief that it's going to work out. I've been lucky with the people I've met along the way. So, there's no one true answer to it. It's up to yourself, I guess, what direction you go to make it work.
You had one more question and then Ben.
Yeah. And my other question would be like, when and how did you decide that you were ready for like proof of concept or like minimum viable like product creation? Because all the time we create prototypes, but prototypes are functioning, maybe they're good, but we're not sure whether they will take off. So when do you decide and make this bold decision?
Prototypes as soon as possible. You have these theories of, is this going to work, is it not, and until you maybe build something and hold it, test it, you don't really know. We can all get ideas and we can put things on paper, but there's nothing like building it and getting in a lab. Minimum viable is tricky in medtech. You can't just push something out. The best you can do is engage with the clinicians who actually would use your device as soon as possible. Get their input as to where you're going right, where you're going wrong. It's amazing, even still, every conversation with a nurse I have, you'll learn something new and important that you can't think of on your own, because these are career people at the front line doing crazy things that are so impressive. More conversations as soon as possible. You're not going to get to try any things with patients in them, but you can certainly find nurses and clinicians who will at least have a conversation with you.
That's one of the fights that I used to have with Katarina, actually, that she will say that, okay, that this is it. You have to, stop designing, stop changing, stop perfecting, because it's never going to be perfect. And I'm like, yes, but if, and then it's perfect that we have these different views. But as Vincent said, like, it's still medtech. So what we did for a minimal viable product is we brought it down to a class 1 device, 1S. So we still need a notified body and all those boring things, but whereas the class 2 device is harder to get approved. So that, I don't know how many of you are doing medical devices. Well, all of us somehow, but I assume it's different if you go into IT and apps and all of these things. I don't know if they're always class 2s. And pharma and all of these weird things, but like, at least for us, it was a possibility to, remove some of the claims. Oh.
Awesome. And we had one more question here.
Talking about classification, that's perfect, because my question is, when and how do you bring in regulatory affairs and legal people? You've talked about the IP management of the consortium between the 5 members. Have you brought lawyers much earlier in the process before applying, or is it now that you have the grant that you brought them, for instance?
Just I suppose the answer to that from my side, at least, is having a grant gives you the funding to have these professional services, so that it makes that decision a lot easier. There was a lot of juggling of those, needing those services, certainly from the patent application side of things, and bringing those costs in at a very early stage. You have to make that determination for the product you have. When is the right time for you? How long can you survive with the funding you have at any single point, and what can you get out of it? So it's there's a mixed answer on it, I guess. Initially, I leaned into good people and took as much off them as I could get from them, and was very well supported by some great people all along the way. You have to kind of be able to dance a little bit. Things are a whole lot better now with funding, and very important at this stage as we build our IP and we build our legal frameworks for the commercial pieces of it, and engaging with very serious big companies, and looking the right way and having the right structures for them is as we look to go to market, and all the opportunities that are there in front of us now. Rebecca.
Well, like I said, the patents is one of the things that we have never been cheap on, if that's a way of phrasing it. We looked at several different patent bureaus, and we ended up with one that we are, if our patent attorney leaves that bureau, we are leaving with him because he's the most brilliant ever. He understands us. It's very time efficient when we work with him. Even though it's horribly expensive, it still ends up being really, really good when he does something. And that's, I said that we needed the funding, we needed the investors in 2019, because then it came all crashing down that you need to pay a lot of money to be able to protect in different countries from the PCT application. So I think that one, like, it depends on what kind of product you have. Like sometimes you can just keep things secret. For us, as part of the business model, we want to sell through license, and then the patent is a big deal. And then you also want to have a priority date as soon as possible. So that we had to do that really early on. When it comes to regulatory, it's also something that we have gotten small pieces of funding for, like 4K for doing an initial analysis. We have this one grant in Sweden where you can have a person, an expert. So you pay them like a consultancy, or Vinnova will pay for them. We also use that for regulatory. I had a good fortune to work for a company that had a really good quality management system. So I could, bring that into my company. And now we got it ISO certified just, the other day we got the certificate. So that's really, really good. But that is also, it's hard to figure out what you did a year ago. So when you are in medical devices, you're supposed to have some kind of traceability. So it's also good to, at least learn, bring a consultancy in to know like which are the things that you should definitely not do. Like which records do you need to keep? Why did you choose to make this prototype at this stage? What was it user requirement that you based whatever it is on? So it's not that you have to have a full QMS from the beginning, but there are some things that it's just really, really annoying to try to remember why you did something when it's, at least if I don't even remember what I had for lunch, and then it's gonna be messy. So, patents, we pay a lot for quality. We try to push as far as possible, but just learn what not to do.
Awesome, thank you so much. And I see that actually the time has flown quite quickly. So if anyone, you dialing in, you have a question, that's the last chance to type it in the chat. We would see it here on the screen. And if you have one more question here in the room today, now it's your last chance to ask that question. Yeah.
What's next? What's the future? Where are you taking this? How are you taking this? How are you going to divide it among the 5 partners? Where do you see this? Where does this product get launched? Where does it get used? How are you going to go about the whole process? Yeah.
It's basically like, are you going to be the first unicorn, or like, what's your ambition?
Okay, Vincent, you go.
I was deferring the hard questions to you, Rebecca, I'm sure. What's next is we deliver on the plan that we put forward for this the Swirl project together. Part of that will be commercializing our technologies jointly. And we have frameworks around how we will do that as individual manufacturers, as well as kind of maybe joint products at a certain point. Our first thing and most important thing is to run the clinical trials with our partners in Portugal and Spain, and to get the results that would actually then allow us to commercialize into all the markets that we're looking at. So, I think our ambition remains the same as it was day one: build our devices, prove they work, get approval, and get into the market at the first opportunity. We'll continue to work as we have set up now. I think Gasgon and TADA are, we'll continue to investigate ways that we can support each other inside of this grant piece of work, as well as any other opportunities that we can get. And I think it's given us the confidence to maybe look at other opportunities as well, and other companies and projects, and use some of the skills we've learned here to maybe deliver other products at certain stages. But right now it's deliver on this project plan.
Awesome. So I didn't see any question from the chat coming in. Well, you missed the opportunity, but the good news is that this is one of the series, and is there a way actually, like if some people are very shy today, either in the room or dialing in, is there a way that they could contact any of you, like Rebecca or Vincent? What's the best way of reaching out if they have some question later? LinkedIn or email or like?
All of the above, I would say.
Or alumni hybrid. Yeah,
What?
Alumni.EIT.
Or LinkedIn.
Yeah, okay.
Or email.
LinkedIn is probably an easy way to do it. I'm going to put my email into the chat there if anyone wants to send an email, get in touch at any stage. You know, we're happy to have discussions. Coming back to my initial point was it is all about talking, and that's how the magic happens. You don't know until you engage, you know, what will come out the other side of it. So yeah, let's network.
Well, awesome. Thank you so much, Rebecca. Thank you so much. Thank you, everybody here attending today, and everybody dialing in or watching the replay on our YouTube channel. If you are interested in other events EIT Health Alumni is organizing, you can go to alumni.eithealth.eu/events, and you can find what's coming up. And the good news is that later today, just in an hour, you can also dial into a next event if you are not registered yet, where we have amazing pitch coach and communication expert dialing in from all the way from Canada overseas to speak what are the tactics you can use either when you're pitching yourself, your company or something like that. But for time being, thank you very much for attending. We close this session and have a new cup of coffee and then dial in for the next one. Thank you so much.